Okay, now let us know about the appendicular skeleton. You already studied about the axial skeleton. Now appendicular skeleton. What is appendicular skeleton? It is a part of our endoskeleton which is located on either side of the axis. Either side of the axis of the body. And another important thing is that these structures are in pairs. Okay. So what it includes? It includes pectoral girdles, that is shoulder bones, both the side, right and left. So two shoulder bones we have, supporting the back muscles, right, and also giving articulation to the bones of our upper arm. So that is the pectoral girdle, and the next is pelvic girdle. That is also called as hip bone, and that gives the support to the bones of the legs. Now let us take up pectoral girdle. It is made up of two bones. One is clavicle and the other is scapula. Clavicle is in front, a bone which is also called as collar bone. Clavicle is also called as collar bone because it is at the base of neck. One from this side, one from the other side. They join in the center, so that clavicle is one bone. So two clavicles are there, one from the right side, another from the left side. Then scapula. Scapula is located on the back side, back of our shoulder, and that gives attachment, surface for the attachment of the back muscles. So that is called as the scapula, which is flat plate-like structure, more or less triangular in shape. Okay, so two scapula we have. Then at the point where the clavicle and the scapula joins, there is one cavity here that is called as glenoid cavity. And this glenoid cavity is the articulation facet, or a cavity where the head region of the humerus bone, that is the bone of the upper arm, is articulating or attaching and forming one joint. There, the joint is called as ball and socket joint. About the joints we will be studying later on. Just now remember that pectoral girdle has got total 4 bones, 2 clavicles, 2 scapula. Right? And as I told you, they are in pair. So one clavicle on right side, another on left side, one scapula on right side, and another one at the left side, like that. Then let's take up the pelvic girdle. Pelvic girdle actually is made up of 2 bones, and each one is called as os innominatum. So there are 2 os innominata. What is os innominatum? It is a fused structure actually formed by 3 bones: ilium, ischium and pubis. And where these 3 bones join on the outer side, there is a cavity called as acetabulum, where the head of the upper leg bone, that is called as a femur, will be articulating, joining here. Okay, allowing free movements of the legs. So this is one half, that means one bone, and similar, exactly the same mirror image will be on the other side. Okay, so these 2 bones are joined in the center here, in front, where there is a pubic part of this os innominatum, by a connective tissue in between, that is forming the pubic symphysis. And this pubic symphysis in men is made up of fibrous connective tissue, not fibrous connective tissue, it's made up of cartilage. Okay, but in case of the women, it is made up of fibrous connective tissue, so that it can be easily loosened at the time of the parturition. Okay, so that difference is there. And again, if you look at the pelvic girdle of male and female, there is a difference. The gap or the space in between the 2 bones, this space, just imagine another bone this side also. Okay, the cavity in between, that is called as that is supporting, that is helping in passing out of the baby during the parturition. So in females, this cavity is wider. The cavity in between the two bones, two os in the manata, is wider, whereas in men it is narrower. So that is how, even if you have a dead skeleton remain in an accident, if the complete body is burnt, we can identify whether that burnt person was a man or woman by looking at the pelvic girdles. Okay, so that's about the pectoral girdle and pelvic girdles, which are very important in supporting the limbs as well as the muscles of the back in case of scapula, and the main seat, the sitting posture, what we are able to achieve is with the help of the pelvic girdle that support our waist region. Okay, waist, there are two words, remember, W-A-I-S-T is the waist part of the body, not that waist, it is a part in between the abdomen and the legs, right, the joining main part, that is called as the waist. So in that region actually we have this pelvic girdle. So always whenever you write word waist for the location of the pelvic girdles, use this spelling. If you write W-A-S-T-E, that will be another waist which we throw out, okay, something waist. Now we have seen here in appendicular skeleton, the total number of bones in the appendicular skeleton are about 126. Okay, 126. Now how many we have seen? Just 1, 2, 3, 4, 5, 6. So we see that through the girdles we got now total 6 bones in the appendicular skeleton. Now let us take up the limb bones. Okay, appendicular skeleton we are studying. So total number of bones in the appendicular skeleton are 126. Just now we have seen that girdles, both pectoral girdle, pelvic girdle together, they make up 6 bones. Okay, and the remaining 120 bones are there in the limbs. We know that we have got 2 upper limbs and 2 lower limbs, arms and legs. So in each arm there are 30 bones. So we have 2 arms, so 30 into 2, so 60 bones in upper limbs, and lower limbs, the legs, right? Each leg has got 30 bones again. So 2 legs, it will make up 60 again. So 60 plus 60, 120. So limb bones total 120, girdles 6. So together the number is 126. That is, the appendicular skeleton has got 126 bones. We have seen that axial skeleton has total 80 bones. And now the appendicular skeleton has total 126. So if you add up these together, we get the number 206. So that is how we have got 206 bones in our body. Now let us know what are the names of the limb bones. First let us take up the upper limb bones. So upper limb bones are humerus, radius, ulna, then carpels, metacarpals, and phalanges. Now let us make out their numbers. As we have two upper limbs, two arms, so humerus, there are two humerus bones. Humerus bone is in the upper arm, right, and that is articulating to the pectoral girdle and the glenoid cavity, okay, on both the sides. So two humerus bones we have, and then radius, in each arm one radius. Radius is the bone of the lower arm, right, which is, you can remember, towards the thumb, the upper side, right. This bone is called as a radius. So radius of this arm and radius of this arm. So two radius bones, and then ulna. Ulna are also two. Ulna bones are also there in the lower part of the upper arm, that is on the lower side. Here we have the ulna, and ulna only has got a process called as olecranon process. Olecranon process that you find as the protuberance or projection here in your arm, right? So this olecranon process is the process of ulna, extension of ulna. So remember, on this the multiple choice questions have been framed, right? In which of the upper limb bones olecranon process is present? So that is ulna. Then carpels. Carpels are actually in each arm. Carpels are located in the wrist region, so they are called as wrist bones also. They are in the wrist region, so these are called as the carpels. So there are about 8 carpels. So we have 2 arms, so 8 plus 8, total 16 carpels we have. 16 carpels we have together in 2 arms. And then metacarpals. Metacarpals are the bones which are supporting our palm region, this region, right? So joining to each of this finger, right, from the carpels, there are long bones called as metacarpals. So these metacarpals are 5 in one hand and 5 in another. So therefore they are 10 in number. So there are 10 metacarpals. And phalanges. What are phalanges? Phalanges are the bones of the digits or the fingers. So if you can see in your fingers, this thumb has got 2 joints. That means 2 bones are there, right? Whereas other fingers, they have 3 joints, 1, 2, 3. So that means 3 bones are there. These bones of the phalanges, these bones are called as phalanges, okay? And therefore, what is the phalangeal formula? Let us see. Phalangeal formula. Phalangeal formula we write like this: 2, 3, 3, 3, 3. That means 2 are in thumb, and then in the first finger, middle finger, ring finger, and the small finger. So altogether in 5 fingers, the arrangement of phalanges are like this. Thumb has got only 2 phalanges or 2 bones, remaining fingers have 3 bones. So that means in one hand the total number of phalanges, how many? 14, isn't it? So we have 2 hands, so 14 into 2, 28. So the total number of phalanges will be 28. Now add up all these. 2 plus 2 plus 2 plus 16 plus 10 and 28. How much? 22, 50 and 60. So total 60 bones are there in the upper limb. Now let us have an idea about how these bones look like, and a very rough diagram I will draw just to understand how exactly these limb bones look like quickly. So here the head of the femur is like this, and this is the humerus we call, and attached to this we have radius and ulna. This is radius and this is ulna, and then there are eight bones that make up the carpels, and from these there are metacarpal bones arising, and these five are the metacarpals. And to these metacarpals, we know that the phalanges are attached. Two phalanges in the thumb, three phalanges in the next finger, in all other fingers they have three. Middle finger is little larger, so the phalanges are little longer. So like this, these are all the phalanges. So this is how each arm or each upper limb we call has got around 30 bones. This is 1 ulna and radius, 2, 3, carpels 8, okay, then metacarpals 5, and phalanges are 14 in number. So if you add up 10, 16, 20 and 30, so total 30 bones are there in one upper limb. Now let us take up the lower limb bones. Lower limb bones, let us see. Lower limb is nothing but the leg. There again, in one leg or one lower limb there are 30 bones. What are these? Let us see. Femur, the thigh bone we call it, femur, then tibia, fibula, patella, tarsals, metatarsals and phalanges. Let's take up their number. in each limb, one femur is there, so total two legs or two lower limbs are there. So therefore, two femurs, the thigh bones, which are the longest bone in our body, that is in the limbs. If you take up the lower limb, the upper part of the lower limb, we call it as the thigh, and that bone which is there supporting the thigh inside, that is called as the femur, and that is the longest limb bone. Okay, so two femur and then tibia. And again, let me tell you one more thing. Femur, the length of the femur in male and female again differ. Men have shorter femur than the women. Why it is so? It's because if you observe, usually the thigh region of the females or the women will be more longer. That is the nature's one kind of gift for them. That is, when they sit, their lap becomes much wider. More space is there so that they can accommodate the newborn baby or the child which they are feeding, breastfeeding. At the time of breastfeeding, when they take the baby on their lap, so the length of the folded legs, right, is wider enough, longer enough, so that the baby can be accommodated. So that is why the femur bone in the female human beings are longer than those of the men. Okay. Now, tibia. Tibia and fibula are the two bones in the lower leg. Okay. Just like how we have radius and ulna in the lower part of the upper limb, in the lower limb we have the tibia and fibula in the lower leg part. So these two bones, so therefore in each leg one tibia, so there are two legs, two tibia, and similarly two fibula. Tibia is the strong thick bone, whereas fibula is very thin bone, and these two are articulating with the femur on the upper side, and down at the lower side they will be articulating with the tarsals further. But there is another bone called as the patella. So one in each leg. Patellar bone is also called as the knee bone, which is also called as a kneecap. And the multiple choice questions mainly are asked on this. What type of bone it is? Patella, a small cap-like bone which is at the knee region. So we call it as knee bone also. It is actually sesamoid bone. Sesamoid bone is bone which is developing from or which is modified from the either fibrous connective tissue or tendon. So if the fibrous connective tissue or tendon is modifying into or developing by calcification into a bone, that is called as the sesamoid bone. So patella is sesamoid bone. So there are two knees, so two patella bones. Then tarsals are there in the feet region. So our feet have got, each foot has got around 7 tarsals, just like wrist in the legs also, where the tibia fibula join with the feet. At that point we have tarsals, and these tarsals are 7 in each of the leg. So 7 means 7 plus 7, total 14 tarsals in 2 legs. Okay. Then attached to the tarsals are the metatarsals, which are main supporting bones of our feet. So metatarsals, because we have got again 5 digits in each of the foot, so therefore there are 5 metatarsals in the right foot and 5 in the left foot. So therefore, there are 10 metatarsals. And of course, the phalanges again remain the same. We see that the hallux, or the first toe, the larger toe, has got only 2 phalanges, and remaining toes in our feet, they have 3 phalanges. So total they are also making 14 on one side. So 14 plus 14, again 28 phalanges in all in our feet. So in both the limbs, the total number of bones, now if you take up, it will be 60. 2, 2, 2 and 2 here. 8 plus 14, that is 22, 30, 40, 50 and 60. So total number of bones in 2 lower limbs. Okay, we have seen that in 2 lower limbs or 2 legs, the total number of bones are 60 again. Now let us look into the bones of one lower limb or one leg with a diagram. Better I will draw a diagram here. Okay, this is the rough diagram to show how the bones are arranged in our lower limb. So this is the femur bone. Actually it should be longer. The diagram is not proportionate. Let me just make it a little more longer. Okay, because that is the longest bone, femur. And then this is the tibia and a thin bone, fibula, and all these seven bones. One, two, three, four, five, six, seven. Okay, 7 bones. So they are taken as the tarsals, and these are the metatarsals, and these are phalanges. So we have one femur bone, one tibia, one fibula, so 2 bones here, tarsals 7, metatarsals 5 in one feet, and the phalanges, if you take up, they are 14. So if you count it, 1, 2, 3, 10. One more thing, one more bone will come here, that is in front it will be, that is the kneecap, or it is called as patella bone. So that is 1. So 1, 2, 3, 4 plus 7, 11, 16, 20, 30. So total 30 bones are there in the lower limb. So this is about the appendicular skeleton we have learnt. Appendicular skeleton in all has got 126 bones. What are these bones and how they are arranged in our limbs and in the girdles we have seen. Now we'll take up the joints. Another very important concept in this chapter is to know about the types of joints and how these joints help us in movements. Okay, now let us start with the joints. We have studied about the skeleton, complete skeletal system, and we have seen what are those 206 bones in our body. Now the movements of our hands, of our legs, movements of the backbone, all these movements we are bringing about, and these movements are at the joints especially. Like if you take up the fingers, I can fold my fingers like this because the joints between the phalanges are allowing me to fold my fingers inward, but they cannot allow me to fold my fingers in opposite direction. Likewise, the joint between the upper arm bone and lower arm bones, right, at the elbow region, allow me to fold inward like this, and I can stretch it like this, 180 degree, right? But I cannot bend it back. Clear? So one way movements. And there are some joints which allow us to show rotatory movement, 360 degree movements, like the movement of the shoulder joint. So I can rotate my hand like this very well, right? So there are different types of joints, and further these joints are classified. Now the basic classification of joints, if you take up, we classify the joints into these main 3 types: fibrous joints, cartilaginous joints, and synovial joints. Let's take up first the fibrous joints. Now what is the meaning of fibrous? Why we are using the term fibrous here? That is because the joints are made between the bones by the help of the fibrous connective tissue. So remember the bones of the cranium you have learned, frontal bone, 2 parietals and the occipital. So these bones, flat bones of the cranium in the skull region, they are joined together by the fibrous joints, and these fibrous joints are immovable. These are immovable joints. So immovable joints are also called as synanthrosis, the type of joints which do not allow movements. These plates of the cranium, they cannot move. They are fixed and they are fitted into each other by the digitation or the saw-like projections which fit into each other, and in between them there is a fibrous connective tissue holding these 2 bones, and this bone with these 2 bones. So these joints, what I have drawn here, they are the fibrous joints. They do not allow any movement and they fix the bones together. Okay. So these joints, therefore, they are called as sutures, as if they are stitched together. So they are called as sutures. Okay. Now let us take up the next type of the joints, cartilaginous joints. Cartilaginous joints, again the name indicates that here cartilage is being used. So there is a cartilage between the two bones, joining them together. So for example, in between our vertebrae, there are the cushion-like small discs, right? So those are called as intervertebral discs in between the vertebrae. Then the vertebrae also have their connection, one vertebra with another vertebra, with their zygomatic processes which they have. They are joined together. Their lateral process are on their sides, and the other processes which are there in the vertebra, they are joined together by the cartilaginous joints. And then between the pubic bones, the two pubic bones where they join in the pelvic girdle, there also we have cartilaginous joints, mainly in the men. In the women, it is more about the fibrous kind of, the ligament is there. So ligament is joining these two, elastic ligament. Then between the ribs and the sternum, we have said that the ribs are connected to the sternum by a piece of cartilage. So that is the cartilaginous joints. And cartilaginous joints allow very slight movements, slightly movable, we can say. Slightly movable joints are given another name, that is amphiarthrosis. Amphiarthrosis. Then the third type of joints, what we call, they are the synovial joints. Synovial joints are called as diarthrosis because they allow free movement. They allow free movement, diarthrosis, and they are also called as synovial joint. They are called as synovial joints because in between the joints there is a greasy liquid. A liquid is there in between them that lubricates the surface of the two bones and allow free movements. That is called as synovial fluid. Now let us try to understand how a synovial joint is formed. Now look at this diagram. These may be the two bones, maybe the two phalanges, right? In between two phalanges, we are showing this joint, how it is working, or it may be the two bones of the limb, upper limb or lower limb, they are joining. So these are the two bones, upper bone and lower bone, and the heads of the bone or the ends of the bone, they have cartilaginous covering, and that cartilaginous covering made up of the hyaline cartilage, that is called as epiphysis. So here we have the epiphysis, the cartilage covering these bones, and there is a small gap, and that gap has to be maintained, and that gap is filled with the synovial fluid. All this becomes a small cavity inside, and outside it is covered by the thick ligaments. Ligaments actually join one bone with the another bone, hold these bones together on the sides all around. So that ligament is forming the outer capsule at the point of the joint, and inside the ligament what we see is there is a single cell thick membrane lining it, and that is called as the synovial membrane. And this synovial membrane secretes the liquid in between, and that liquid lubricates the surfaces and therefore allow free movements. What happens in old age, usually in most of the cases, the synovial membrane will be degenerating and there is no more fluid in between. And what happens is these cartilaginous ends will start rubbing each other, and as the friction continues, the cartilage also will be thinned or damaged, worn out, and bone to bone contact starts, and all this leads to arthritis, right? There is a pain and inflammation in this region. Usually in old age it happens if the synovial fluid dries up. Okay, so this is about the synovial joints, and synovial joints are the most common joints in our body. In most of the regions we find these joints. There are again different types. So these synovial joints further can be, see where they are. They are there in between the limb bones, in between the limb and the girdles, in between the phalanges, right? In between the what you call the wrist bones, and between the first and second vertebra, and between the skull and the vertebral column, the first vertebra. So all these joints are synovial type of joints which allow free movements. Let's take up the different types of synovial joints. So I have listed here the types of synovial joints. Condyloid joints, which are there in the skull region. We know that the skull has got an opening through which the spinal cord comes out from the brain. That is called as foramen magnum. Just near it, towards the ventral side of the foramen magnum, right? On either side of this opening, there are some bulged bony parts. These are called as condyles. And to this, the first vertebra, which is called as the atlas, it is articulating. So the first vertebra or the atlas has got these articulation facets, articulating facets. So first vertebra, which is ring-like atlas, is called as atlas vertebra, is fixed to the skull. The skull is big, the diagram is improportionate, so this is the skull, and here these condyles are articulating with the articulation facets in the atlas vertebra, and this is called as condyloid joints. And this joint will not allow the rotatory movement. Only side to side movement we can do, because there are two condyles which are fixed like this to the vertebral column. So we can do sideways movements, but we cannot rotate our head. So this is called as biaxial diarthrosis. So where two condyles are being fixed, but in case of the birds, what we see is there is only one condyle, and therefore birds are able to rotate their head 360 degree. They can rotate their head, they can very well turn their head back, but we cannot turn our head back because there are two condyloid joints. Okay, then ball and socket joint. Ball and socket joint is the joint which allows 360 degree movements. Free 360 degree movements are allowed by ball and socket joint. It is called so because for example, if you take up the joint between humerus, head of the humerus, and the glenoid cavity in the scapula, that is the part of the pectoral girdle. So this looks like a ball fitted into a cavity, a socket. So ball and socket joint, this is called as, and this kind of joint allows 360 degree movement. So therefore we can very well rotate our arm, which is connected at the shoulder region. So that is ball and socket joint. Remember, all these are the synovial joints where you have a similar structure. Okay. Then hinge joint. Hinge joint is given the name based on the hinge plate we have in the doors. For example, when you open and close the door, where door is fitted to the framework of the door is fitted now, there you find some hinges which allow only folding one side, not other side. So therefore they are called as hinge joints. Elbow joint, for example. So this ball and socket joint, the main example is the shoulder joint, you can say. Shoulder joint is the example of ball and socket type of joint. Now let us take up. And similarly, where another ball and socket joint is located, another ball and socket joint is located in the hip region. That is the articulation of the head of the femur bone, okay, head of the femur bone with the acetabular cavity of the pelvic girdle, okay. So that is also known as the ball and socket joint, which also allows the 360-degree movement. We can very well rotate our leg. Then hinge joints. I was talking to you about the hinge joint, which allow only one-way movement, like for example elbow joint. Elbow joint can allow us to fold the hand up to 180 degrees. So they are allowing 180-degree movements only, not 360-degree. We cannot we cannot bend it backward, right? So that's why it is hinge joint. The elbow joint as well as the knee joint, both are the hinge joints. So they allow 180-degree movements, and the examples of the hinge joint are elbow joint, and knee joint. So these are the examples of the hinge joint. Legs, for example, we can bend it back like this, but we cannot bend it forward. And if that was the case, we would not have been able to walk at all, right? So that's how these joints are helping us in proper movements. Then, gliding joint. Gliding means when two plates can glide over each other, can slide over like this. So they are called as gliding joints. Gliding joints are allowing limited movements, and these gliding joints we find in the wrist bones, that is in between the carpal bones. Carpal bones, in between carpal bones there are gliding joints. And then the pivot joint. Pivot joint allows rotatory movement. Or revolving movement, and it is between the atlas and axis. What is atlas and what is axis? Atlas is the first vertebra and axis is the second vertebra. So these two are articulating by a kind of joint called as pivot joint, where the atlas is a ring-like vertebra, and the next vertebra, second cervical vertebra is called as the axis, and which has got a process, and that is articulating a elongated projection, that is articulating with the joint, that is with the atlas, forming what is called as pivot joints, and that allows this rotatory movements. So that's why when we turn our head on both the sides, the backbone is not getting tilted. Right? Backbone is in its position. Only the atlas will be rotating. Atlas vertebra, the first ring-like vertebra will be rotating, and this rotatory movement between the first and second vertebra, that is allowed by the pivot joint. And that kind of process is called as orontary process. Suppose this is the ring-like first vertebra, and here say the articular facet is there, and to this the another vertebra, here the second one I am drawing. So it has got odontoid process, and that odontoid process allows little rotatory movements. So that's about the pivot joint. And then we have the saddle joint. Saddle joint is the joint between the metatarsal and the phalanges. For example, at the thumb region, this is metacarpal, and this is the thumb. The joint between the metacarpal and the phalanges, first phalange of the thumb. So if you take it, it allows the movements forward and backward, upward and downward movements. So all these movements are possible. Those are called as saddle joints. Saddle joints, and where the bones are fitted in such a way that they allow the to and fro and side by side movements and up and down movements. So that is called as saddle joint. That is there at the point where the phalanx of the thumb is joining with the carpal bone. Okay, wrist bone. So that is called as saddle joint. So these are the different types of joints, and all these joints which we have now according to this list gone through, they are all synovial joints, or the free movement diaptosis like joints, and they allow free movements, right? But at different degrees and different directions, as we have said. And all these joints have the similar internal structure, that is, they have the synovial fluid, synovial membrane, and ligament surrounding the two bones in the connection. Okay, so now we have studied the types of joints. Remember all these joints. Definitely the questions do appear from the joints section of this topic in terms of multiple choices. Now students, we have come to the last leg of this topic, that is about the diseases of skeletal and muscular system. There are only 4 diseases mentioned in your NCERT syllabus, so let us talk about these only. The first disease mentioned here is Myasthenia Gravis. That is the degeneration of neuromuscular junction, where the nerve is joining with the muscle and stimulating the muscle to undergo contraction. Those parts, there is a defect, and that is because of the autoimmune. Autoimmune means our own immune system is attacking our own body cells and destroying them, and this leads to the degeneration of the muscle slowly, and ultimately what happens is it leads to the complete paralysis. Okay, so this is autoimmune disease. So that is the degeneration of muscles and failure of neuromuscular junctions. It leads to paralysis. Similarly, muscular dystrophy, another disease, and this is due to a defective gene, so therefore genetic disorder. Gradually what happens after the birth of the child, slowly the muscles start degenerating, and it leads to complete paralysis and even death of the body. So it is the gradual degeneration of the muscles. Slowly the child will be losing the muscular activity, becomes completely paralyzed and dies out. That is the muscular dystrophy. And then arthritis, which is the disease of the joint, inflammation in the joints, and this is maybe due to the old age, or due to infection in the joints like knee joints, elbow joints, etc. And that leads to inflammation, and a lot of pain will be there in between the joints, and even the synovial membrane is destroyed. So this is a common disease seen in most of the people at the older age. Okay, so this is causing the inflammation of the joints, and the movements become very painful. That is what called as arthritis. And one more is there related to that. Osteoporosis. Let's take up before this one. Osteoporosis, that is the bones become spongy and fragile and break easily. This is also seen in older women, especially when the estrogen levels decrease after menopause, and that causes the spongy bones. The calcium from the bones gets degraded, and the bones become very weak and fragile, and that may lead to very easy fractures. Just by slipping and falling down, the bones will undergo fracture. So that is the condition called as osteoporosis. A similar kind of the disease which is seen in men, it may be called as Osteomalacia, where the bones become weaker due to old age, as the deposition of the calcium absorption and its deposition reduces, and the hormones which are controlling their secretions also become less and less in older age. That also leads to the similar kind of condition. And the last one is gout. Gout is also swelling in the joints, right? And this is seen because of the more accumulation of the uric acid. That is called as the gout. And if the blood is tested for the concentration of the uric acid, and the uric acid levels are higher than the normal, then it is confirmed that the joint pain is because of the gout. And just by giving medicines, drinking a lot of water, and reducing the intake of protein-rich food, especially the animal proteins, intake of animal proteins, flesh and all, if you reduce, then the uric acid will be decreasing, and there are medicines available to make sure that the uric acid levels remain lower, and by that way the gout can be easily treated. So with this we have seen some of the diseases connected to the bones and the muscles, and with this we have completed this topic. I'll be back again with another topic in our video classes. Bye.